So my name is Larry Suva. I'm a professor in the Department of Veterinary Physiology and Pharmacology in the College of Veterinary Medicine and Biomedical Sciences here at Texas A&M University. For 200 years, people have been regenerating limbs from other species, salamanders, obviously, that we know about the most. And what these studies really have done is tell the scientific and regeneration community that mammals, like mice and humans, haven't lost the ability to regenerate their digits and joints, which was long-held idea. But in fact, that capability is just buried in the cellular milieu. And if we can activate those cells and rejuvenate those cells, then that regeneration process is possible again. The initial thinking would be people who have had amputations. And that's a reasonable and appropriate aspirational goal. But in the immediate future and the immediate use, perhaps not so much people who have had amputations, but people who have had amputations where the wound from that amputation is many years old and they continue to have issues with fibrosis. The studies that we've just published suggest that it might be reasonable to do some modifications with growth factors at those sites to potentially keep that fibrotic tissue from degrading as much as it does, creating big problems for people with amputations. We now have mammalian models in which we can investigate the processes of activating those cells. And we use growth factors in this setting, FGF and BMP, but those pathways might be able to be activated in other mammalian species and presumably also in humans. And so the future has changed because the data that we've uncovered and have published now is suggesting that, as I said, the ability to regenerate has not been lost to evolution, it's just been hidden. And so now we have a way to reignite that process. And we don't control it, the cells control it. There's positional information that's encoded in all of our cells, even sidedness. So cells that grow on the right side versus the left side are programmed and positionally know how to do that. There are some species where people have got a better handle on the sidedness of regeneration, but in mammalian situations that it's not quite as well understood. If we have an amputation of a right limb, when we stimulate it to regenerate, it will regenerate the right-handed side, not the left-handed side. But we don't really understand all of the details as to why. So evolution is a fantastic teacher, right? And so in aquatic species, the threat of being predated and losing a limb, you're less likely to bleed out. And so in those species, the amphibians, it's an advantage to manage to escape and then regrow the limb. In other predation species, like mammals, for example, small mammals, if the limb is amputated, the very first thing that's necessary is to scab over. We've got to stop the bleeding. And so the evolution has decided that mammalian species that lose their limbs should live. Great, that's very helpful for us. And two, that in order to live, they have to stop the bleeding. And so that means make a scab, make a fibrotic tissue, prevent bleeding, and as we all know amputees, people know of people with pets that have been amputated, and the animals do just fine. And so evolution has selected for that, but evolution doesn't waste anything, and so the capability to have a different regenerative response is still there. And so what our research has done has uncover a way to initiate that response with timed addition of 2 growth factors. The evolutionary response might be a whole bunch of other growth factors. We just don't know what they are. What we know is that with FGF and BMP, we can initiate a regenerative response that will recreate that amputated joint structure. And so that suggests that evolution didn't dump that data, didn't dump the idea that it was possible. It's just a much more secondary or tertiary response. And so if we can modify the response, then we can let the wound heal over and people not bleed out, thank goodness, and then potentially remodify that fibrotic scab to potentially start to regenerate the aspects of that wound. Clinical trials for regeneration of a limb far away. But clinical trials using approved growth factors like BMP and FGF2 is also in a clinical trial at the moment for other issue. Once FDA approved, then clinical trials to look at amputation stump remodeling and fibrosis remodeling it would be very feasible and easy to do once both of the agents that we use in this study are FDA approved. And as I said, FGF2 is very close to approval. So the next step in the research is to test the idea that the fibrotic response can also be modified. So we know that if we amputate at a certain level, we'll get a considerable fibrotic response. The idea and the things we've been trying to do next are to let that fibrotic event happen, let the wound scab over, if you like, or scar over, and then see if we can reactivate the process from within that fibrotic stump. Dr. Munioka, the senior author and the brainchild behind these studies, has spent his entire career making the argument that evolution is incredible, but the information is still there, and that we should be able to initiate this regenerative response. When I met Dr. Munioka 11 years ago when I came to Texas A&M University, he was passionate about this being the case. And I told him at the time, I don't think that's possible. Here we are 11 years later, and we've done it. That's pretty cool.